Hi, Gary DeSmith with Allegiant Physical Therapy in Durham, New Hampshire. Back with you to talk about some exercises that are really great if you're experiencing shoulder pain. So typically with folks with shoulder pain are going to complain, and this Julie is here with us today, is going to complain of pain on the outside of the shoulder or sometimes on the inside part of the shoulder, the front part of the shoulder. And again, we'll tend to experience that or feel that with different kinds of reaching activities, whether it be reaching way overhead or behind the back or what have you. So these are just a few exercises to work on the coordination of the muscles. In a previous post, we talked about the things that are important for dealing with shoulder pain and impingement, including balances of flexibility and strength. These exercises are specifically for reteaching the muscles and improving the coordination of the muscles to help them work right, help the shoulder to track more normally, and therefore over time not to hurt. So we're going to go right into the exercises now, and there's 4 exercises that we're going to show you that you can try. The first exercise is specifically for the shoulder blades and to train them and to strengthen them. So Julie is pulling back on the band for a count of 5, and she's pulling back as far as her hips. And when she does that, she's purposefully pinching her shoulder blades together and holding them there for a count of 5. And we're going to ask her to do 15 of those pulls in a row if she can. Julie, if you can only get to 10 or so, that's fine. So 10 to 15 pulls in a row. You'll probably feel those muscles starting to get a little tired between the shoulder blades. Excellent, very good. So bear in mind that with this shoulder strengthening, if you have a problem with your shoulder that involves pain, you should always make sure that the exercises that you're doing are fully comfortable. You never want to do an exercise that's causing you pain in the shoulder, okay? Good. So conversely, the second exercise is specifically going to use the rotator cuff. So this is for rotator cuff strengthening. While she's doing this exercise where she's pulling out on the TheraBand, she's going to start around the area of her belly button and then only come out to about here. That's good. And it's going to be continuous motion. There's no hold time with this exercise. But notice that she is standing very tall with her shoulder blades pulled back. So it's very important to reteach these muscles to be nice and stable while you're using these shoulder muscles. And this exercise we're going to do until you get tired. So we're not going to count repetitions. Good. So when you get tired, that's the end of the set. And you'd rest for a full minute before you start and do another set. Start with trying to get 3 separate sets of these exercises, and as you get stronger, you can advance to doing 4 and then 5 sets. Okay? This next exercise is going to start to pull everything together. So this is her starting position with the TheraBand, and she's going to pull back and hold, once again for a count of 5. This is going to work her rotator cuff muscles and her shoulder blade muscles at the same time. That's what we mean by pulling it all together. Once again, a 5-second hold, and you're going to go until tiredness on this exercise as well. How's that feeling?
I have to really concentrate.
Looks great. Okay, good. Did you feel those muscles working?
I did.
Okay, very good. Okay, and the last exercise is also going to pull everything together. This is a really, really important exercise for this kind of problem. And the key here, once again, is keeping the shoulder blades tightened and in position. Okay? And what Julie doesn't want to do when she does this is shrug her shoulders up in the air. Okay? We don't want to let that happen at all. You're going to keep those shoulder blades tightened and lowered as you do the arm raises. This exercise is going to be continuous motion, no hold time. Okay, good. So you can see her tightening those shoulder blade muscles as she does the raises. Very good. Continuous motion. And once again, you'd go till tiredness or till 15, whichever comes first. So again, those are 4 fairly simple but really, really effective exercises that you can use to help with your shoulder pain. I hope that helps you. Please leave us a comment down below. And thank you for tuning in. Gary from Allegiant Physical Therapy in Durham, New Hampshire. Thanks for tuning in again, and we'll see you next time. Thank you.